Good morning all of you. I am GNM third year student Rashmi Tambar. I am going to explain about the structure of female pelvis. The female pelvis, because of its characteristics, it aids in the childbirthing process. It is made up of two innominate hip bones, one sacroiliac bone and sacropophygeal bone. It has 5 ligaments: pelvic ligaments, sacropophygeal ligament, sacroiliac ligament, sacrospinous ligament and sacrotuberous ligaments. According to the obstetric point of view, it is divided into two types. One is true pelvis. A true pelvis is a type of pelvis in which it facilitates the fetus to pass through it, that it can allow the normal delivery of the baby. And next is the false pelvis. The false pelvis does not have any significance in the normal labor process. Now, types of pelvis according to the anatomical classification of pelvis. It has 4 classifications. One is gynecoid pelvis. It is also known as female pelvis. It is present in 50% of cases. Next is android pelvis. It is also known as male pelvis. It is present in 20% of cases. Next is platypod pelvis. It is a rare type of pelvis. It is present in 5% of the cases. Next is anthropod pelvis, which is present in 20% of the cases. Let's talk about the landmarks of the pelvis. This is pubic symphysis, pubic tubercle, pubic crest, pectineal line, iliopubic eminence, iliopectineal line, sacroiliac articulation, ala of sacrum and sacral promontory. These are landmarks of the pelvis. They are significant while studying the diameters of the pelvis. Let's study the diameters of the pelvis. Before studying the diameter of the pelvis, let's talk about the 3 divisions of the pelvis. First, it is inlet, or it is also known as brim, next cavity, and next is outlet of the pelvis. Let's talk about the diameter of the pelvic inlet. It has 5 diameters. First is anterior posterior diameter. It is the distance between inner part of the upper border of pubic symphysis to the midpoint of the sacral promontory. It is 11 cm. Next diagonal conjugate. It is the distance between midpoint of the pubic symphysis to the midpoint of the sacral promontory. It is 10 cm. And next obstetric conjugate. It is the distance between the inferior border of pubic symphysis to the sacral promontory, and it is 12 cm in length. Next, transverse diameter. It is the farthest distance and most longest distance among all the diameters, and it is 13 cm in length. It is the distance between two iliopectineal lines. Next, oblique diameter. The oblique diameter is the distance between the iliopubic eminence and sacroiliac articulation. It is 12 cm. Let's talk about the diameters of cavity. It has 2 diameters. First is anterior posterior diameter. It is the distance between midpoint of pubic symphysis to the joint of second third of sacral vertebrae. It is 12 cm in length. And next, transverse diameter. It is the distance between soft tissue covering occipital foramina and sacroiliac notches. It is also 12 cm in length. Let's talk about the diameters of the pelvic outlet. It has 3 diameters. First is anterior posterior diameter. It is the distance between the inferior border of the pubic symphysis to the end of the sacrum. It is 11 cm in length. Next, bispinous diameter or transverse diameter. It is the distance between two ischial spines. It is 10.5 cm. Next, posterior sagittal diameter. It is the distance between midpoint of bispinous diameter to the end point of the sacrum. It is 5 cm in length. Thank you.